This is part 2, prioritize people. You put the interest of people using or needing nursing or midwifery service first. You make their care and safety your main concern and make sure that their dignity is preserved and their needs are recognized, assessed, and responded to. You make sure that those receiving care are treated with respect, that their rights are upheld, and that their discriminatory attitudes and behaviors towards those receiving care are challenged. Number 1. Treat people as individuals and uphold their dignity. To achieve this, you must treat people with kindness, respect, and compassion. Make sure you deliver the fundamentals of care effectively. So, in this sentence, what's the meaning of fundamentals of care? So, if you look at this, the fundamentals of care include, but are not limited to, nutrition, hydration, bladder and bowel care, physical handling, and making sure that those receiving care are kept in clean and hygiene conditions. It includes making sure that those receiving care have adequate access to nutrition and hydration, and making sure that you provide help to those who are not able to feed themselves or drink fluid unaided. Okay, so you have to make sure you deliver the fundamentals of care effectively. So you also must avoid making assumptions and recognize diversity and individual choice. You must make sure that any treatment, assistance, or care for which you are responsible is delivered without undue delay. You must respect and uphold people's human rights. Number 2. Listen to people and respond to their preference and concerns. To achieve this, you must work in a partnership with people to make sure you deliver care effectively. Work in partnership. And also, you must recognize and respect the contribution that people can make to their own health and well-being. You must encourage and empower people to share in decisions about their treatment and care. You must respect the level to which people receiving care want to be involved in decision about their own health, well-being, and care. You must respect, support, and document a person's rights to accept or refuse care and treatment. You must recognize when people are anxious or in distress and respond compassionately and politely. Number 3, make sure that people's physical, social, and psychological needs are assessed and responded to. To achieve these, you must pay special attention to promoting well-being, preventing ill health, and meeting the changing health and care needs of people during all life stages. You must recognize and respond compassionately to the needs of those who are in the last few days and hours of life. Act in partnership with those receiving care, helping them to assess relevant health and social care, information, and support when they need it. You must act as an advocate for the vulnerable, challenging poor practice and discriminatory attitudes and behavior relating to their care. Number 4, act in the best interest of people at all times. To achieve this, you must balance the need to act in the best interest of people at all times with the requirements to respect a person's rights to accept or refuse treatment. You must make sure that you get properly informed consent and document it before carrying out any action. You must keep to all relevant laws about mental capacity and apply in the country in which you are practicing, and make sure that the rights and best interests of those who lack capacity are still at the center of the decision-making process. You must tell colleagues, your manager, and the person receiving care if you have a conscious objection to a particular procedure and arrange for a suitably qualified colleague to take over responsibility for that person's care. Number 5, respect people's right to privacy and confidentiality. As a nurse, midwife, or nursing associate, you owe a duty of confidentiality to all those who are receiving care. This includes making sure that they are informed about their care and that information about them is shared appropriately. To achieve this, you must respect a person's right to privacy in all aspects of their care. This is very important. You must make sure that people are informed about how and why information is used and shared by those who will be providing care. You must respect that a person's right to privacy and confidentiality continues after they have died. You must share necessary information with other health and care professionals and agencies only when the interests of patient safety and public protection override the need for confidentiality. You must share with people, their families, and their carers as far as the law allows the information they want or need to know about their health, care, and ongoing treatments sensitively and in a way they can understand.